Hello, everyone. It's time for an update. It's been a couple weeks now. We have to say that our numbers are increasing. Our number in our town has gone down. Last week we were in the low to mid 20s for COVID cases in our town. Today we are a lot lower than that. But countywide, statewide, the numbers are going up. And there's only one way we can prevent that, and that's by doing the right thing ourselves. So let me go right into the countywide statistics. Confirmed cases, 8,456. Tests completed, 309,250. Active cases, 1,102. Hospitalizations as of today, 93. Unfortunately, fatalities are now at 200. And today, as of 11 a.m. this morning, when I checked the dashboard for the county, our town of Dover had 10 active cases. And like I said, down from 23, 21, 23, I think we were at last week. Our 7-day rolling average in our region is at 6.3% positive results. State and county information from the state of New York. In a press conference this week, Andrew Cuomo announced that if the statewide and regional hospitalization rates do not stabilize within 5 days, indoor dining would be banned in New York City, and capacity would be reduced from 50% to 25% for the rest of the state. That could be coming down the road. I thought maybe we'd hear by now, but we haven't. He also did state that gyms, barbers, hair salons will not be required to close if indoor capacity is reduced to 25%. Gyms, barbers, and hair salons will not be required to close. Additionally, hospitals are required to expand their hospital bed capacity by 25% to handle the increase in hospitalizations. The CDC has also released new guidance on what individuals should do if they come into contact with someone who has tested positive for COVID-19, or if an individual begins to experience symptoms of COVID-19. Notably, the isolation time has been reduced from 14 days to 10. The guidance can be found on the CDC website. I suggest you go there. And again, any of our businesses that have any questions, you can always go to contact@duchessbnn.com. Some websites that you should know, you should go to, you should read, would be www.cdc.gov/coronavirus/2019-NCOV. Or you can call the coronavirus hotline at 1-888-364-3065. And of course, you can go to duchessny.gov. Click on all the links. Read up on what you need to read up on. And again, we do share everything that we possibly can do. Also from the state, he has his top 5 priorities. The New York State strategy: 1, emergency hospital procedures; 2, testing; 3, keep schools open safely; 4, small gatherings. Spread is the number one spreader, and I'll explain a little bit of that in a little while. And then 5, the vaccination process. From our county, our conference call this week is our update. I'll read it just as it's written to us. The county executive discussed the growth in active cases and hospitalizations. Dutchess County has seen active positive COVID-19 cases rise from 613 cases 2 weeks ago to 1,102 active cases today. Hospitalizations have likewise risen, going from 39 hospitalizations 2 weeks ago to 93 current hospitalizations today. The rate of growth in hospitalization is alarming and not sustainable, said our county executive. Each of us have a personal responsibility to help prevent the spread of COVID-19. And please, agree or disagree, the data is clear. Wearing a mask, physical distancing, and personal hygiene all help prevent the spread of the virus. Until the vaccine is widely available, we cannot give into fatigue or impatience. We must redouble our commitment to the preventive measures that help keep our family, our friends, and our community safe. That was a quote. That is the way he wrote it. I have to agree. We flattened the curve by doing what we were advised to do. We did. We can't say we didn't. The county executive also stated if the rate of hospitalization grows, restrictions will occur within the state and the regions. It's going to come. It's going to come. We're going to see some restrictions handed down. Testing infrastructure is stressed. The testing facilities are busy. They are overwhelmed. Dutchess County is working with the state and other entities to find and create solutions for that issue. From our Deputy Executive, Ron Hicks, we have issued step-by-step guidance for our businesses regarding COVID, best practices, and the process when an exposure may occur. Please direct any questions or concerns to him. You can get him at Ron Hicks at dutchessny.gov. The total number of active cases is the highest the county has reported since May 13th. All right. From Monday to Saturday of last week, days after Thanksgiving and Black Friday, the number of active cases in the county increased 55.4%. The jump in cases was part of a similar increase in most counties across the state. From the week of Thanksgiving and Black Friday, the number of active cases have increased 55.4%. That is a huge, huge number, people. Meanwhile, Dutchess schools have reported 54 individuals who had tested positive in their communities between December 1st and this past Monday. All right. Last month, Dr. Vadian, our county health commissioner, said the contact tracing system was stressed and is facing staffing shortages, even though we haven't gotten rid of any. And it's all due to the increase in cases. It's a fact. It's true. Bullets and notes that we all need to know and we all need to think about. Again, the rate of hospitalization is not sustainable. It is not sustainable. This week's report from our county executive, hospitals may be overwhelmed before we know it. He mentioned the end of the month, shortly after New Year's. Hospitals are being taxed due to the length of the stay for COVID patients and the increase in cases. Test results have slowed down. You get your results not in that first day or two, is from what I'm being told, but you get them, but not as fast as we had been. So test results have slowed down due to the increase. Contact tracing will not be immediate. You may be called, but you don't know when. So if you know you've been in contact, or if somebody has been in contact, they need to tell you, a friend, a family member, a fellow coworker. Should all take the responsibility and just notify your fellow coworkers, your family members. If you feel you've been in contact or have been told, take your own responsibility and tell the people that need to be told, please. The contact tracing system is getting overwhelmed. Again, like I said and like I read from our executive, and it will get worse. The quote he used, well, it'll get worse before it gets worse. And I have to agree. But you need to know, agree or not, the data and increased cases through tracing and information given by the patients, over 65% of the cases are tracing back to gatherings, both small or large. The contact tracing, the information that each and every one of them people that test positive give, 65% plus are all going back to some form of gathering. Okay, we knew this would happen. The holiday season is here. Holiday season starts with the night before Thanksgiving, goes through Thanksgiving, through Black Friday, Hanukkah, the holiday season, Christmas and New Year's. We knew it was going to happen. We had to be mentally prepared, and here we are. It's hitting us now, ladies and gentlemen. We as public officials have been asked again to state how important it is to follow the requests, follow the guidelines, and the directives that are sent down from Albany and the county. I read them to you every couple weeks. It is time, and once again, to sound the alarm, our county executive stated, that we put out, and same alarm that we put out in late March, early April. Masks, stay home if you don't need to go out. Hygiene, avoid non-essential gatherings. And when you can't, keep the numbers low. Sit apart in your houses. Wear masks if you can't keep a 6-foot distance. They're not saying you can't. They're just asking you to avoid and keep the numbers low. That's all we're asking. Help yourselves by helping others. I highly recommend that you watch the videos that we share from our Health Department Commissioner, Dr. Vidin. It's important information. It's statistics. It's answers to questions that many people have. Watch it. We share it on our social media pages. I share it on mine. Everybody that's a friend of mine, they share it if they can. Watch it. It's good information. Again, we are in it every day. We are in it again. We knew we would be. Like I said, I don't know how many times. We need to be more careful. We need to be safer. We need to be smarter. We need to get into 2021. Put 2020 behind us and put it in the record books. Get it out of here. We need to get people well. We need to flatten the curve once again. With that, I'm going to say my quotes earlier because we are in a battle again. We are determined. We need to get through it. I found 2 today. The first one says, "You've got to stay strong to be strong in tough times." And we've been strong since March. That hashtag Dover Strong has stuck, and it's stayed stuck. We use it. We live by it. We believe in it, and I do too. The second one by the great Margaret Thatcher. "You may have to fight a battle more than once to win it." So I thought they were fitting going into a rough winter. It's going to be long. But some notes that you all can know: our planning board will continue to meet electronically through video using Zoom and our social media pages. The town board will continue to keep a regular meeting because the numbers are low, the amount of people that we need to have there are much less than our planning board, so we're able to spread out, stay 6 feet apart at our 6-foot tables, and separate from the dais down in the front. So we will keep doing that. This, of course, it will change. If they start handing down regulations, it will change, and we'll do what we need to do. We'll do what we need to do at the town hall. We are fully prepared. We have met. Staff members have met with myself, our town clerk, our highway superintendent, Jason Sartori. He is prepared to do what we had to do back in the spring. If the word comes down, we are ready, and we've been ready. Again, and then if inclement weather comes in, we will adjust and do what we have to do there. We have meetings set for next Wednesday, 16th, at 6:30, and then again on December 30th. The 30th will be 2 meetings. You can tune in at 6:30 on DTV. It will be our regular meeting of the month, and then I will adjourn, and around 5-10 minutes later, we will open back up again and go into our special meeting. We can do our reorganizational meeting that same night this year. So we'll do our reorg meeting for 2021 after our regular meeting on the 20th. So you can tune in at 6:30 for the regular meeting. We will take a short break to get ready for my reorg meeting, and then we will go from there. I want to leave you all with just a few things. A reminder: remember those who are sick. Remember those who are quarantined and stuck at home. Hope and pray that they get better and that their tests come back negative, and those who are sick just get well. Keep checking on family and friends, and especially our senior citizens, which we've stressed since the beginning. But most of all, we have lost some town residents in the last couple weeks. Some of them I've known for a long time. One of them, I am sorry to say, was definitely due to our COVID issue. My thoughts and prayers are with his family and especially his wife and his children. I want to wish everybody a happy Hanukkah, those of you who celebrate it, to all of you who celebrate it. And as always, please, please be well, stay safe, and most of all, please try to do whatever you can to stay healthy. And always remember, we are Dover, and we are strong, and we are Dover strong. We are one team, we are one town, and we are the town of Dover. Until next time, everybody, be well, have a good night, and a great weekend. Good night, everyone, and hashtag Dover Strong.